Hey, welcome. I did have some technical difficulties. Uh, just got my internet switched over and I forgot to change my internet on my computer. I also have company today. Colts won. See my Colts shirt, so pretty excited. Today we're going to just cover some questions. I do have one of my friends over watching the game right now, so if you hear any background noise, it is him, and he's very loud. So we're going to go to the questions and answering, and if anybody that comes on, I see we got a couple people on. If you have any questions, just please put them in the comment section, and I'll definitely try to look and see where that's at. So again, sorry about the technical difficulties, and we'll just go on from there. So. All right, so here's a question from, I believe, earlier today. What are some of the things you should look for when you take over a new building? Okay, so when you take over a new building and this, pre getting the job and post getting the job, when you are being interviewed for a facility, some of the things and questions you should ask for. Usually, they may interview you at the building or they may interview you at a different location because potentially the administrator is still in the building and they want to conduct searches for administrators where you might not be able to see the building right away. They might ask you to go take a look at the building over the weekend. So some of the questions you should ask in an interview, you want to find out about your staff, how long your DON been there, if their qualifications, ask about different staff members, especially your department heads. Your department heads are so important because you want to make sure you have the right team. A lot of administrators, when they leave one facility, they like to bring a lot of their people with them. That's just becoming more and more common every day where let's say I leave one facility and I have a good food service director. I might want to bring them with me because your whole thing is about comfort and knowing that you don't have to worry about different positions. So the more that you can trust one of your department heads, the more you're going to want to take them with you everywhere you go. If you have a good DON, you'll be like, yeah, I'm getting a job somewhere else. Do you mind coming with me or not? But most of the time, they already have somebody in that position and the corporation might like that person. So when you end your interview, you might want to ask, how long the DON been here? What are some of the survey results that the building had over the last 2 or 3 years? Because you don't want to walk into any kind of trouble situation where you didn't know about it. So the more you ask questions about the history of the building, the more that you can get a better picture on if this building is something that you might want to take over or be hired for. That is very important. Some other questions you want to ask about financials. Definitely try to find out, are you in a building with low census? And if you are, and are you meeting your goals on the census side? How's the marketer doing? How many residents is the current marketer bringing in per month? Do they go out and market? Where's your key marketing or your referral sources are coming from? Are they coming from the hospital? Are they coming from different types of facilities? Some nursing homes get filled up with behavioral hospital type residents, and I guess we'll cover that in the future about having a lot of behaviors in your building. But you definitely want to ask those types of questions. You shouldn't get into a nursing home your first day and don't know anything previously about the building. Do your research. Ask questions from your peers in the industry. Is this facility somewhere you would go? Have you heard anything about the facility? When you become an administrator, you're, like I said earlier, when I was answering someone's question on YouTube, that your peers, you're gonna learn more and more of other administrators in the industry just by getting your CEU classes or places where you all meet, like happy hours after work, where someone is doing free drinks for all administrators or social workers, or inviting people to congregate because they're trying to get your business at the nursing home. So they usually invite out nursing home administrators. So just make sure you're not going into a troubled building, because they definitely know what buildings are good and which one are bad. So if you're going into a troubled building, it can be a lot of difficulty just getting over the building's history, and you don't want to go into a bad position where state is in your building all the time. So definitely ask those questions, and the corporation or the HR compliance manager that's interviewing you before you get to the RDO, or if you are talking to the RDO, just make sure you find out as much as you can about that facility, and any problems that it currently has or had in the past, because that's very important. And you don't want to be caught with your pants down. That's basically all I can say. Now, when you get into the facility, your first day, some of the questions that you're going to ask your nurses and your DON, you want to take a look at recent falls. You want to take a look at tracking of the infection control. Those are just different things that once you become administrator, when you sit in front of that chair, you want to take a look. Ask a lot of questions, walk around, and meet with every department head, and walk, if you say food service director, walk the kitchen, take a look around. Everything that you learned during testing and in your classroom, try to put that to use. Look and see if you see any deficiencies and take care of those immediately, because now you're sitting in the main chair and they're going to be looking for you for answers. If there's something that you do need to get fixed, get it fixed immediately, because it's almost the longer you're there, the more that it just kind of fades into your existence, where you don't notice it anymore. So brand new eyes is in your court. You see something that they might be like, wow, yeah, they've been like that for a couple of years now. But if you see it for the first time and that was your first time in the building, definitely a surveyor is going to come in there and see it too. So you might as well go ahead and get it fixed and make sure that it is up to par. The more things you can just knock off your book, the better that you would have in longevity of. That's one less thing you have to get fixed before state comes in for their annual survey. All right, let's see. I'm starting my master's in healthcare administration in January. I'm having a hard time finding an AIT position in South Louisiana. Okay, an AIT position. I know some of my subscribers that were looking for AIT. Only thing I can tell you is basically the same thing. Every state has, let's see if I can find right now the AIT list for Texas. Let's see. It used to be a lot easier when Texas used to have DADS, Aging and Department of Aging and Disability. Now they switch over to HHSC. DADS AIT. Let's see. All right, so it did bring me up under HHSC. HHS. Let's see if I can find but if you go to your state website, they should have a list of preceptors. Oh, I should have put preceptors. Let me start over. Instead of preceptors. And it's a printable list of preceptors, in your area with phone numbers. Um, let's see, here we go. HHSC administrators. Like I said, they've been a long time since I actually had to, let's see, the list used to be really easy to find, but I know I'm dealing with time since I'm live. I'll probably, let me see if I can take a definite look. There we go. Public search. This may or may not be it, but it used to be a printable list of all preceptors in Texas. And I'm sure if you either try to Google it or call your state representative for nursing homes, they'll be able to point you in the right direction. So definitely try to go in your state and try to get a preceptor list. So you can definitely get you someone to be your preceptor. All right, Louisiana, huh? Okay. Patricia Cooper, what do you suggest if you never worked as an administrator that have no experience? Should you start out at a nursing home facility? Many people do. Definitely try to get a nursing home. The best training and experience you're gonna get is sitting in that chair. And then I'll tell you, the first day you sit in that chair, and you all your knowledge is gonna just kick in, but it's gonna be difficult at first. You might have been an A student. I just looked at my transcript for being a nurse home administrator. It was like 3.5, 3.6. But definitely, when you sit in that chair, it's going to be a moment where you're going to be very startled and frazzled because you don't have anybody next to you. So definitely try to find a job as an administrator. The home size is what you should be trying to look for. You don't want to start off in a 120 to 180 bed facility or 150 bed facility. Try to find a smaller home. They got homes in rural areas that are 60 bed, 80 beds, some 40 bed homes. I would just say start small and move your way up. My first home was a 60 bed facility. I'm in the Metroplex area, and usually it is hard to find a job as a brand new administrator. They ask you to put in your time because if you look on Indeed or Career Builder, when you look at ads for jobs for administrators, it usually say 2 to 5 years experience. How do you get that 2 to 5 years of experience? I had to move 3 hours away and worked at a smaller home for a year, and then they moved me to another facility because I did so well, and moved there, and that was for another year. So definitely try to find a smaller home for your first nursing home. What I do like about being in a rural area, corporate is not that much because most corporates are in major metroplex areas. So it'll give you time to adjust where you might not have a lot of corporate support coming in your home, and you can get more used to your home before you start having a lot of corporate people in. When you're in a metroplex, every day you might see somebody for corporate because they don't want to go out to the other homes in the rural areas because that means they might have to drive, they might have to spend the night. So those are some of the pros to having a small rural area because they'll probably email you a lot, but they're not trying to come out there to the home and take a look at it every day or every week. My first job, I see my regional person once a month on a Thursday, and they'll go come in the facility, spend about an hour to 3 hours because it was multiple homes in the area. So they would spend at the least an hour, at the most like half a day, 4 hours, and then went to the other home for the after lunch and try to drive back to the Metroplex area. All right. let me know if you do find the information. So I will, because I can look deeper. I just didn't want to spend all my time on live looking for AITs for Louisiana. And I know you said South Louisiana, but it would be for the state of Louisiana. And I really don't know a lot about Louisiana nursing homes, but definitely, we'll definitely take a look at that together if you can't find anything. So let me know. Uh, all right. So let's say you said I'm in the Metroplex area too. Yeah. So you might have to go out to a rural area. What city are you in, or what state are you in, if you don't mind me asking? And because what I'll do now, I look up Indeed and try to find a small home for you in between questions. Oh, you're in Texas? Okay. Oh well, definitely. If you're in Texas, there are certain corporations that are in the lower half of Texas. Regency. They are always looking for administrators. I know they got homes in Beaumont. I was actually going to do some interim work for one of their homes. Let's look at Indeed real quick. Let's see. Indeed. Let me see. Are you in the Dallas area or Houston? Let me see. Okay, here we go. All right, so in Dallas area, okay. All right, let's see. Haven't been on Indeed so long. Let me see. Nursing home administrators in Texas. All right. So let's see. Oh, Regency Integrated Health Services. They're actually looking for someone in the Dallas area right now. Um, let's see. So if you go to Indeed right now, there are a couple of jobs in the Dallas area. Creative Solutions is looking for a nurse home administrator in Wichita Falls. So where there's not a lot of administrators at in Wichita Falls, definitely that'd be a lot closer than I had to go. I had to drive through Wichita Falls. My first nursing home job was in Quanah, Texas. So if you ever look that up on a map, that's where I was at. I actually lived in Vernon, and it was 30 minutes between Vernon and Quanah, Quanah. When I was in Vernon, I just drove 30 minutes because it was too small of a town. So definitely try to take time out and say, yeah, to further my career, will I have to move away for 2 years or so. But at the same time, you can definitely start looking and see if anybody, while you're in those small towns, you just gotta have something that show that you're doing a good job wherever you're at. Right now, Alvin, Texas is looking for an administrator. Um, let's see. Genesis, they're out of state, but like I said, if you're interested in moving, then that might be an opportunity for you to get with Genesis. Creative Solutions is looking for a administrator in Palestine, Texas. Uh, Focus, they're looking for somebody in Midland. Definitely, Patricia, if you want a job and you just want a job and don't care anything, they are always hiring new administrators around the border. Let's see, there's a CEU site. It's two of them. I'm trying to figure which one. Think to myself which one might be the one where they have jobs on the side. But I think it's Spring Seasons Seminar. Let's see, I forgot the seasons. And let's see, Spring Season Seminar. CEUs. So they say. can't find spring seasons. Let's try. Wow, my mind just went blank. Uh, what was it called? I will have to look it up, but there's where you get CEUs. They usually post for administrators jobs that's in Texas that are hard to fill. Uh, Definitely, if you're so you never have did any work as an administrator, this would be your first job. So if this is your first job, oh no, so you have been an administrator before? Okay. Definitely. Oh, well, you know, you've never been an administrator before. Okay. Yeah. So it's usually, even let me try to go back, but there's usually always a position in that small border town close to El Paso, Mexico. There's a lot of jobs in El Paso, but you just have to be acceptable to move to those jobs. So, uh, what does a nursing home administrator do daily? All right, let me walk you through a day as an administrator. When you get there, you know you're gonna go in. Definitely walk around your facility, inside and outside. And I try to do that before morning stand up. Morning stand up in facilities are usually around 9 o'clock. Have seen them start as early as 8:30, but I like a good 9 o'clock. That gives time for all department heads to either try to finish up. If you're your food service director and had to do breakfast, then definitely you want to give them time. So you don't want to start too early. Um, your DON, they need to do a startup before the stand up that give them time to go and talk with nurses, get all the reports, everything to bring to the meeting. But you want to just walk and definitely just try to take a look at your residents, making sure they're getting up. In my building, I want all showers done before 10 o'clock, and no excuses. I might look like a softie on here, but I do make sure everybody's taken care of in my nursing home. But definitely make sure that the CNAs are busy. That's a busy time. If you get there around 8 o'clock in the morning as an administrator, 8 to 8:30. If you're running a little bit late, you know you get there at 8:30. Never just get there at 9 o'clock. Try to get there around 8 in the morning. Your staff, if you run a 6 to 2, 2 to 10, 10 to 6 on staffing, that means the staff should have been there about 8 o'clock. You should see them finishing up in the dining room, do a tour in your kitchen, make sure everything, that there's no issues. You want to just be seen. Lead by walking around is actually one of the test questions. I remember that. And I do not know. I see a lot of people asking me about the questions on the test. I took the test in 2004. So this is now 2020. That's 16 years ago. I can't recall every question. I just know that definitely study your regulations in your book. That's the only thing. You know, you get 3 times. So if you do take it, and I definitely don't suggest that you take the NAB and the state at once, and now not got the financial component. Definitely schedule those separate. I made the erroneous mistake of trying to take 2 tests in one day and didn't fare out too well. The state test is pretty simple. I would start with that one first if you're good in memorization. The NAB has a lot of the James Allen book, and I was not a fan of James Allen book. Uh, I think I even Googled him, and I think he was a administrator. I can't remember if it was in the 80s or 70s or when he was an administrator. And a lot of the ways that he did things were really old fashioned to me, but those are the answers to the test. So for that time frame, definitely just follow the test and try to learn more about James Allen as possible. Uh, I'm I hate to say I'm kind of like a new school approach type of administrator because, James Allen don't tell you what happens when you have a drunk cook. It don't tell you how to. It's kind of situations where everything is 100% good in his book. So I don't want to say I'm from the streets, but sometimes you gotta know how to handle unprofessional situations in a professional manner, and I don't think I got that from the James Allen book. So, okay, so 8 o'clock you get there. Next thing you're going to do is walk inside your building, and I always like to walk out my building. Make sure that on the outside you see trash because during breakfast the next day they should be out there cleaning up trash. And so I get with my housekeeper. Either we'll do a round together, or I'll go by myself and do a round outside and make sure that there's no trash, there's no broken water hoses or is put up. I want to make sure the cosmetics of my building look good. You're selling a product, so you want to make sure that when someone sees your facility, that they see the best that it can be. So walk around your facility outside in the parking lot, making sure that there's no cans or paper wrappers or anything that draws attention away from the beautification of your facility and makes it look ugly. Check for leaky water. Wow, because I'm just going to tell you, in my house, I had a leaky toilet for 2 months, and my water bill went up 25%. Just think about that in nursing homes. Grab a maintenance man and do a walkthrough if you do have an issue. Say, hey, we need to go ahead and get this fixed right away. So that's from 8 to 9. The latter part, let's say I get there 8, did all that, and about 8:30, 8:45, I'm going to go check my email, making sure corporate has sent, if they did send any messages or anything for me to take a look at from the previous night. I know a lot of people skip that step because now most corporations use Outlook, so you can look at that constantly. So if you can combine looking at your Outlook on your phone and doing a walkthrough, go right ahead. When you're doing your walkthrough inside, that's when you're going to have residents approach you and say, hey, I didn't get a shower, or my TV's not. So you can take those and take them back to your morning stand-up. Some facilities do what is called angel rounds or quality rounds, where they give certain sections. Let's say you got a 100 bed facility, and let's say you got 5 department heads. Each one takes 20 residents, usually a hall, and then they bring that information to the morning stand-up. So that's one way you can tackle it. I'm not a big fan of angel rounds until like the survey window is open, because I'm more active than a lot of my employees, where I'm talking to each resident. Usually when I leave a facility, my residents are the first ones that come up to me and thank me, because I'm not an in-office administrator. I don't like to put my trust in anyone. So I want to talk to all my residents, make sure that they are happy, and then we're doing the best that we can for them. So and every day I try to reach out to a lot of the residents that are ambulatory, at least, and then go to the ones that are bed bound, like at least every couple of hours myself. You got to do what nurses should be doing, but a lot of them don't do. CNAs, and that's probably a test question. Every 2 hours, the nursing should be doing rounds. So the way that I try to manage my rounds, I'm like, well, CNAs, you should put eyes on everybody from 6, 8, 10, 12, and continue. Nurses, you're the odd number, 7, 9, 11, so forth. So you get a lot of nurses, they fall in love with the nurses station, and they never even go down the hall. I once had to get on the nurse one time. They documented on a resident that was already sent to the hospital. So I brought him to my office. I said, oh, how's let's say Miss Smith. How's Miss Smith doing again? You documented that, she was doing great. And this, I'm like, do you know Miss Smith is at the hospital? So definitely one for the book. So You by you walking around, you gain more knowledge, and knowledge is everything that you need. And you leaving? All right. Like I said earlier, I had a friend over watching the game. Who won? Who won? Kansas City. All right. I'll see you next time. All right. So definitely try to know everything about your facility. The more you know about the facility, the more that the less that somebody else can tell you something wrong, and they would definitely try you. So 9 o'clock is when you start your um, morning stand up, and that's when you're gathering more information. Uh, okay, hold on, let me finish the day today. Sitting at a table just like I'm sitting at a table, and you going around. You have a, a form. Usually, I carry my own form when I go to a new facility, and it just goes down the list. What's our census for today? And then it breaks down our census to Medicaid, Medicare, private pay, Medicaid pending. So you'll have all that information, and if you're doing and you can see if your business office manager is making sure that all your stuff is, you shouldn't have somebody pending for a whole year unless there's some major problems. If they don't have Social Security, it could be as much as 6 months before you get them approved. But usually you should be able to get the average person approved with Social Security anywhere from 3 months to 4 months at the top. Probably less than that. 45 days is my usual turnaround rate if we have everything. But definitely try to get all your information from each department. One of the things I do ask is for food service, what's the meal of the day? You'll be surprised how many times you'll see how many people during the day before lunch ask you what's for lunch, especially if you're an administrator that walks around and makes sure and ask questions with the residents. They'll say, "Hey, what we having today?" And from your morning stand up, you should be able to tell them we have spaghetti with garlic bread, green beans, and let's say pie for dessert. It's also a time opportunity. Remember, state regulations is you have to have one starch, one vegetable. So a couple of times, I like, well, where's the vegetable at? And they say, oh, we forgot the vegetable. So definitely make sure that if they're not following their menu, that they do substitute correctly, because that is a deficiency if they do not substitute correctly. After your morning stand up, definitely go to your office, make sure if you have anybody, usually that's the time around about 9:30, 10. If you had anybody that you're interviewing for positions, or anybody that you might have made appointments with, or anybody after the meeting that they want to talk to you privately right after the meeting. Family members might be coming up there, so usually around 10 o'clock is when I have people meet me at the facility. If we have a previous meeting coming up, I'll say meet me around 10 o'clock. So that's your time there. No 2 days are the same. So some of this may vary. You might get there at 9 and then you see 2 people or 1 person coming up and it's state surveyor. You can't just continue to follow your day to day. You're gonna have to jump into action, make sure you handle the surveyor, getting them everything they need. If it's a self-report, getting them a copy of your self-report. If it's a complaint, you still got to get all the information they need, which is basically they're going to want a list of current employees, department heads, residents that can communicate and that they can communicate with, your 802, 672. They usually give you a list of things to look for. So I don't want to get off track. So basically managing from 10 to 12. Now, certain times, if I got a good facility, that's when I would go to lunch. If I don't have a good facility, from 12 to 1, and some corporations might ask you to do this, be part of the lunch, go in there, pass trays. I've been in positions where I can tell the director of nurses more about a resident eating habits than they know because if they went to lunch or they're dealing with other issues, and I'm consistently making sure I'm passing out trays in the dining room area, making sure that, because I had surveyors ask the CNAs, do he always do this? And they say, oh yeah, he does this all the time, because they don't want you to switch routines, because a lot of people only do that when stayed in their building. But I go out and pass out trays, and then I usually go to lunch. But making sure everybody had something to eat, just so nobody was missed. Making sure if somebody wants seconds, because you as an administrator, you are very professional. That does not say, now, this is where real world kicks in. Not to say everybody you're going to work with is very professional. Not to say everybody you work with cares if Mrs. Smith has a piece of pie, or they can say, oh, well, we ain't got any more. We have more, because you can lead to a lot of complaints. And like when I first started this YouTube, I told you, you can make sure that your building runs smoothly. So if you're going to just get into being an administrator just to sit behind a desk all day, you are going to be one written up administrator, because you're not going to know certain things. My whole key for you and the people listening is to make sure you stay on top of it. Do your walk arounds. Make sure at lunchtime everybody gets their desired menu. Because I have facilities, residents say, yeah, they didn't say they didn't even have bacon today. Go back there. There's a whole thing of bacon back there. So you have to hold your staff to your standard and not fall to their standard. And that's very important. Holding your staff to the standard that you want. Because being a nurse home administrator, that means you must have a 4-year degree. That means that you had to do some type of schooling after that. My program was 2 years to be an administrator, but I think now they got it to 6 months and then a 6-month internship. But so you have higher learning. A lot of the staff that you are hiring may not have that knowledge or that kind of moral value or ethics. So it's up to you to make sure that they hold to that standard that you have in you. And if not, then it might be time to move on to someone else that does care. So 1 o'clock, or let's say lunch is over 12:30, 1:30, let's say about 2. Make sure you do another walkthrough, because that's when your new staff is coming on and your old staff is leaving, doing rounds. If you do rounds, then you won't have this discussion in your facility. Oh, well, they left these people wet, because you're doing rounds, and they're more likely not to leave anybody wet as CNAs if they know you do rounds around 2 o'clock. And my rule of thumb is, if you don't, I tell the CNAs that's coming in and the CNAs that are going out that they need to do rounds together. Unlike if you took ownership and this person's already gone, it falls on you after that on the 2 to 10 shift. So make sure they do rounds constantly on their own. And then when they about to switch shifts, they should do rounds with the incoming person for their shift also. But once you do rounds, that should last about 2:30, ask questions. And I know you said daily. By that time, people have been grabbing you and, ask you, can they speak with you in private, and had questions, or you're looking up, let's say your washer and dryer go down. You're going to be just doing constant work most of the day. On a high level day, you're going to be doing everything that you can. Just make sure, once a month, you're going to do your QA meetings, QAPI meetings. Usually on certain days, you're going to have those type of things. But basically, I think I answered your day-to-day questions. Like I said, no 2 days are the same. That day, probably about 10 to 15% of what I did per day. But basically, people are going to be in and out of your office all day asking you questions. But I usually get those questions while I'm doing walkthroughs. Since I've been doing interim work, they're mostly like, you do a lot of walking around. I'm like, yeah, I'll try to do it myself, 8, 10, 12 when I pass out lunch trays, 2 o'clock and 4 o'clock, just personally. So Lead by walking around. The more they see you, like I said, the less problem you're going to have in your facility because you're going to run right into those problems. You walk in the kitchen and you see them tempering with the control on the refrigerator. You know, you're going to be in there, hey, what's going on? Anything wrong? You know, let's go. Oh, I'm going to go look up, you know, our, you know, corporate account where who fixes our refrigerator. So it's just that type of work. Let's see. Next question. How do you handle all the paperwork that has to be sent in when you have different occurrences? Do you have a system on how you handle these things? Let's see. All right, let me answer the first question. Different occurrences as in incidents, like I think you're referring to, let's say I have a self-report. That's a good question. I was going to just make a video on that, but I can tell you quickly when you have different occurrences. So are you talking about like there's allegedly abuse and neglect, different occurrences, or something happened in the facility? I think that's what you're referring to. Right away, if it's abuse and neglect, whoever it's against, you got to go ahead. Okay. You have to suspend that person immediately. Scenario, you know, a resident comes to you and say, so-and-so was a little rough, or, you know, something that, you know, somebody might told you about a resident by another employee. You have to suspend that person immediately. Then what you want to do is your investigation part, but you have to call that in first to your state. Now it's all online. It switched 2 years ago. Now you only have 2 hours. That's why I do not like to work at a nursing home. If I'm working from home and going there, that's more than 2 hours, because now the window has shortened to 2 hours on certain things that you have to report. Definitely try to get a statement before they leave, and then let them know that you're going to have to suspend them. Just let them know, don't take it personal, you know, but try to get all the information you can. And the way that I do my investigations, I like to write, well, not write, but type as they talk, and then let them sign it at the end. And then at the top part, make sure you put interviewing so-and-so in their position on this date in private office with the administrator. And then I put that at the top line, and then administrator, can you tell me what happened with Mrs. So-and-so? And then below I start typing their statement, and then let them check it and read it. Because a lot of administrators, I guess, in nursing homes, they just tell them to write a statement. I'm not a fan of that, because you might have different questions after they write a statement, and then they're no longer there, or you can't reach them anymore. So I like to write my statement as they talk, and or call them in. And let's say it happened the night before. I call them in, let them know I need you to come up here immediately before you are able to return back to work, and I need to talk to you. After that, let them sign a suspension form, let them know that they're suspended, that they cannot talk to anybody about the case. If you have any additional information, please contact me or the DON, and then we could do addendum to what they wrote before, if they had anything else, or they thought of anything else after that. So you when you make that phone call or do it online, where you do a self-report, you have 5 working days, 5 calendar days to make sure. No, I guess it's working days. I work with a surveyor that was corporate, and I always thought it was 5 working days. They said, calendar days. They said, no, it's 5 working days. So, and now once you do a self-report, it actually prints out, I know in Texas, the day that is that you have to have all your additional information in. Then you're going to get an intake number. What I usually do is have 2 manila folders and write the incident is talking about at the top with the date, today's date on it. Because if they come in on that as a self-report, they're going to say, I'm here, let's say Mrs. Smith on 12/18. and I always have an 8. I have 2 of them because all the information I have in one packet, I'm going to make a copy and put it in the other and put them together. Let's say I'm not there that day. I could tell the DON, give them the copy on 1118 Miss Smith, so they can just go on my desk and grab it. But never give your original to the surveyors because they will walk away with it several times. And sometimes they know, or sometimes they'll lose it, or say they didn't take it with them. So I just let them know this is yours. Do anything you want with it. So once I get all my information compiled up to send in for the 5-day, it's a copy already made, and I've got both copies. So my original and my copy. When you let's see where we at so you want to investigate. When you do an investigation, make sure that anybody that worked on that shift, let's say you don't have a perpetrator. Let's say Miss Smith had I just left the incident like this. Miss Smith had a black eye that materialized at 7 o'clock, 8 o'clock. So I'm going to interview everybody from the previous shift. I'm going to interview everybody that dealt with Miss Smith on that current shift. That's one of the things state looks at. They want to make sure that you did a good investigation and you got everybody involved. There's certain questions that I ask. I can cover that. Like I said, I was going to plan on making a video just about this anyway. But once you ask everybody certain questions, did you see anybody go in the room? Did you see Miss Smith fall? And then you get your DON involved. Was Miss Smith on any medications that could have caused this bruising? One of the things that a lot of people think of it when they see abuse is people who are on Coumadin. You could touch somebody, especially if they're Caucasian, and it'll leave marks because Coumadin is a blood thinner, and I had a lot of incidents where it was just a blood thinner. This is once you call it in. Sometimes you don't have to call it in as long as you know if it's not an unknown origin. And Miss Smith say, yeah, I fell, and she's alert and oriented. You wouldn't have to call that in. But let's say they're not oriented and you don't know how it is, call it in. When in doubt, call it in. I say I only got 1 like. I got 4 people on here. I'm not giving y'all enough good information. All right. Well, I'll try a little bit harder. What you need now is safety rounds. So that's part of your investigation. Safety rounds is I usually just have my social worker. Thank you. I usually have my social worker. As soon as I get an investigation, everybody kind of know their job. So social worker is going to get 10% of the census. So let's say I got 80 residents. 5 is good. 5 to 8 is good. Where they ask 4 questions, and I turn that in with the survey. I'm gonna turn in the demographic sheet with the survey to on the self-report. I'm going to turn in any information if it's 2 people, their face sheets. You want to turn all that stuff in, and then your investigations, and then your form that you fill out at the end when you do a final on it and say, okay, was it? When you're doing your conclusion, it's 4 things: unconfirmed, confirmed. It's 2 other ones on there. I just can't think of them right now. Yeah, make sure when you have your packet in, and one of the surveyors, when they read one of mine, they's like, "Are you a lawyer?" I'm like, "No." They like, "You write like a lawyer," because I like doing investigations. I hate that investigation come up, but when it happens, I'm pretty good at it. That's why I didn't have a deficiency in 9 years. Because if you cover one time a surveyor left everything that they look for on surveys, so that's kind of how I got my information on what you need to have in there, so you don't get a deficiency. And then it's just up to you to make the right decision. Because if you can't figure out if this person did it, they're not either. Let's just like one of my latest cases was when COVID got in the bill. They couldn't. At the facility level, was it the staff or was it the resident? So if you can't figure it out, they won't be able to figure it out, and they can't go on hunches. So the whole survey process is basically black and white, where it has to be defined that this person did do it, within at least 90%. So you can always argue and um, IDR it. Like you can't say this happened because of that, and they can't, because if you have to ever IDR anything, it's just like court. They can't prove that this happened, and if you can't, without a shadow of a doubt, prove it, you can always IDR anything that gets you a bad deficiency. So in your packet, before you send it, fax it or email it back to state. I think now there's more than 15 pages they want to email. Just make sure you have all the information pertaining to the case. Make sure that you have your quality rounds. And quality rounds is I just use my own 4 questions. You see, how is staff treating you? How's the food? Is there, do you feel safe? And is there anything that, you would like to tell me, basically? So they just go around 5 to 8 people. Like I said, I usually try to do 10% of the population, people who are like-minded, like the person that the investigation is going. Let's say Ms. Smith is on hall 1. And the person in question works hall 1. I wouldn't go and ask hall 5 because they never worked with this particular person that I'm trying to investigate. So if there are bed-bound and you want to try to interview bed-bound people that the alleged perpetrator has dealt with, let's say Miss Jones is the CNA that we're talking about, and she worked hall 1, sometimes hall 5 and 6. You want to have people, if this person is bed-bound, then you want to try to interview bed-bound people. This person a walkie-talkie, you want to try to interview people a walkie-talkie. So you see if there's a pattern. So out of the 8 people, let's say they're all bed-bound, and let's say Jones worked with all 8 of them, and only one person saying this, then it's kind of shed a little light. Now, if you start getting all bed-bound people, she don't get us up, or she don't get me up either, then you know that Jones is the problem. So you try to eliminate and try to investigate almost like a detective when you're an administrator. And nowadays, a lot of DONs are doing a lot of these, but I always like to do my own because the nurses code, the unwritten nurses code, if you down a CNA, that means life is harder for that DON. It's harder for me too, because I always have empathy with my DON, but definitely you don't want them saying, well, you won't do it again. Well, you just get back to work. So I like to do my own investigations. So you turn all that in, and I hope I didn't miss anything. But yeah, that's how you do your paperwork for different occurrences. I think I answered your question. How do you do your planning for short and long-term goals? Let's see. Okay, so your short and long-term goals. Well, let's say what would be one of your long-term goals? Let's say increase census by let's see, anything longer than 6 months. Let's say you want to get to 15 additional residents. Just proper planning. How do you handle your short-term, long-term goal? Usually your RDO, they're going to give you goals, and they're going to give you a vision on where they want the corporation and for your facility. And those kind of come hand in hand. A lot of those are going to be passed off from corporate, your goals. Usually your RDO going to sit and talk to you, say, we need to get this point here. We need to get down, let's say falls. One of the things I dealt with falls. Your fall rate is too high in your building. So what you want to do is co-op it. Make sure that you sit down with all your nurses, everybody who would have direct access to making sure that this goal happened, and then you set your long-term goals and your short-term goals. I just copied COVID-19. So I within a month, we're going to make sure that we decrease by 10, all the way to 3 months where we won't have a new case. So, and then you just put into action, how are you going to make sure that happens? proper hand washing, more in services, more department heads walking around, making sure everybody have masks, we need to order more sanitizer, more PPE equipment. So some of those things would be in your planning for goals, and make sure that you follow through, and then you check it. I did a beautiful spreadsheet on what we currently have, what we are forecast to have, and how we're going to make sure that that goes down. So kind of hope that answered your question for planning. Just make sure you cooperate with your team and have everybody on board, because you can have a game plan, but if they don't know your game plan or felt like they was part of your game plan, then you're gonna have a lot of people just like, well, he made it by himself or she made it by herself. Let them do it by themselves. But once you incorporate a team environment, they're more likely to follow their part, and then make sure you ask for feedback. Don't never try to do it. You may be able to do it on your own, but you got to know how to stir them to what you already want. Because a lot of things you want is going to come from them anyway. So you just have to ask the right questions to get them to see your vision, because it's not their vision, it's your vision ultimately, but you can't do it alone. You need their help, and you need them to make sure that it's going along accordingly. We had a QAPI one time when we was just asking what are some of our issues when QAPI first happened. One was the breakfast is cold. So I put on the PIP, we put the DON and the food service director. Was the food cold for breakfast because of the equipment where it didn't stay warm long enough, or food was coming out too early or too late, or was it the CNAs not finishing up in time and grabbing the food trays off there? So they had to watch for 2 or 3 weeks every morning, and then together, because it's teamwork. So if you ask somebody from food service, they said, oh, the CNAs are not getting the trays off in time. If you ask the CNAs, oh, well, they're not bringing it down in a proper time, and that food just came out and we took it off there right away. So you have to have your PIP and have teams go out there and try to see what the problem is. So when they come back and you can see a decrease or increase, but more likely you're going to see a decrease, because when staff know that you're watching them, they're going to do what is correct at that time, and you can see where the problem is. But some things you can't change. If you got a late cook, you're always going to have a late cook. Maybe for not one day, but over a period of two weeks, they're going to be late again. And the true nature of people come out, not when you first meet them, but after you start watching them for a while. So if it's CNA's not doing it, yeah, they might be perfect at 2 or 3 days, but then after that, they can only fake it for so long, and then they're going to go back to the routine of what they were doing. And right then and there, our team is going to be there and say, okay, yeah, the CNAs are not going to the trade and taking them out. Or, yeah, we do need to invest in a concealed dining room tray when we roll out the food. So that's one way that you can use short-term and long-term. And then when you put in your plan is everybody should have hot food. That should be your main goal, or what you're shooting for. So have times where food tray came out this time, so you can eliminate why the food is cold. And if you can do that with each problem that you come up with, just QAPI and PIP it, your facility will run very smoothly. All right, let's see. Alexis Adams, what are some of the first things you look for or address when starting at a new building? I think I kind of answered that, Alexis. It was like one of my first questions, but I could tell you when I first walk in, you can go in, and I'll tell you, if you are an administrator, you probably already know this, you can't go in soft. You need to go in at your highest peak level where, this is not fun and games. You can always decrease, but if you go in there laughing, joking, try to make friends with your employees, they're never going to have your respect. They're going to always think of you like that. If you go in strong and then, let them peel maybe one layer, but even if they peel away a lot of layers, they know when you first came, they know when you mean business, when you give them that look. But you go in there laughing, joking, they're going to eat you alive. Uh, what I like to address is any problems that I heard about. Let's say I go into a new facility, RDO say, okay, we having problems with staffing. So you kind of know what to look for at the start of your building, because and when you become administrator, you should know, you will know how you want your building. So I look for things that I know is out of place. Things that I'm used to routine. Oh, y'all don't do it like this? Okay, how y'all do it? Is it working? Oh, okay, well, if it's not working, I can tell you how, I'm used to doing it. So I kind of look for my patterns in each building. And if it's not broke, I don't try to fix it. If it's broke, I can then say, this is how, I've done it in another facility. It has worked. Maybe we should try it this way. And then, get their feedback. They might want to tweak it a little bit. Not all no facility is the same. You can't go into one nursing home and say, okay, we did it this way at this building, because it might not be set up like that. And you're definitely going to fail, because not all two buildings are the same. So you want to actually try to get the feel of the new facility, and keep in your mind that, you do have different ways to do things, but see if it's working. I've been to new facilities, and I like the way they do things, and I took it with me to other facilities, and when they needed help. But no two facilities are the same, and I definitely do not suggest that you try to approach them. A lot of administrators do. They try to mold each facility alike, and it's a lot of times a disaster, because they don't have the proper staffing. It might not be the right way to do it in certain locations. One of the things even in food service, they were using a North menu for the South, where I'm like, well, they don't, the menu was actually developed in Massachusetts. And I'm like, we're a Texas home. We want more chicken fried steaks. We want more gravies. We want more mashed potatoes. We want more Southern food. People wouldn't even eat. They're like, clam chowder, or, white fish. We want some catfish. So definitely no two nursing homes are the same. And you have to just take what you know. Don't try to make a lot of changes. A lot of administrators try to go in there and change the nursing home and ruin it. You just want to concentrate on areas that are broke, that need fixing, that everybody agreed need fixing, and try to work on those areas. But if you go in there and they're doing something completely different than you have ever seen, and it's working, don't be that administrator. Go in there and say, oh, well, now we're going to do it my way. Because you do get a lot of those types of administrators. A lot of facilities that I, did interim work for, and then they hired a new administrator. That's the first thing they said. They trying to come in here and change everything. Well, you didn't do that. I'm like, yeah, because it wasn't broke. So don't try to go in nursing homes to just make you feel comfortable. It's all about your staff and your residents. All right. What other questions? I know I had some questions previously that I was going to try to answer. I think it was on my email. Okay, here we go. Hold on. Let's see. I know Hector de Jesus, he said, can you do some training on financial side of being an administrator? It really, you're going to get taught by your corporate what they look for. I can tell you now, probably 90% of facilities use either Point Click Care or Matrix. And all those have a profit and loss, financial component. So I've seen a lot of people ask about the financial aspects. I don't understand a lot of that. You're going to know and your RDO will cover that with you. So it's not a way that I can answer that question other than what are you specifically want on financials. But a lot of that is going to be corporate operated and driven by software. I know I did a little time with one company, and the reports that they print out and you get bonuses off of, so once you get your financial report, what you need to improve on, what you need to look at, what you like you'll know. It's whatever you read, you was in the red on. Just try to get that fixed. If it was maintenance man, it might have been $4,000 as your budget, and they've been spending $6,000 religiously. You might need to go have a talk with the maintenance man and say, okay, there's so many things that we're outsourcing. Can we do insource? Which I did a video on. Having good maintenance man versus somebody that you just basically paying like anybody that you paying just to change light bulbs and do a little painting. I mean, I'm a firm believer they don't need that much. Maintenance man can be making could be making $9 to $12 if they're not doing anything hard labor where they're saving you costs. If you always got to call out a repairman for something that you got a maintenance man for, then you might just want to get you a $9 to $12 person and save that $20 to $25 for somebody who has HVAC or someone that can fix a lot of the high-end appliances. But just by doing interim work, I had one guy, he was making probably almost $30, but every time I asked him to fix something, he couldn't fix it. So we had to call somebody out for this. Yeah. We had to call somebody out for this. Yeah. So long term, if I was going to be there long term, I don't think he would have been my maintenance man very much longer. So definitely you want to, on the financial side, take a look at your financials, see where you can improve on and make those improvements. So let's see. I know it was a lady. I know she emailed me, but I thought it showed up on here. It was something to deal with census data and some other questions. Let's see. Let's see. All right. Any other questions? I definitely would like to answer all your questions. And I guess I should have took a snapshot of the questions before I got on here, but I did not. Did y'all find this? Did you learn anything new today, or did you find it helpful at all? Well, I didn't want to do it if it's not helpful, but I do see a lot of comments that people asking different questions after I do a video, and I wanted to try to answer a lot of those questions today because like I said, I got a little free time now, so I definitely wanted to take a look at all the questions that have been asked. Let's see, I almost graduated healthcare bachelor's in healthcare. My question is, how do nursing home administrators get paid? Do they receive a salary or they get paid by hours? No, you always get a salary. In my experience, I've never seen an administrator get paid hourly. That might be a facility or a corporation you might not want to work for. Definitely you're going to get paid salary because your weekends, you're going to be doing a lot of work on weekends sometimes or at night. So hourly, usually the only people that are salary in a nursing home is the administrator and director of nurses. Sometimes corporations, they will make the food service director salaried, or maybe all the department head salary, but I've never seen an administrator be hourly. So definitely salary. Let's see. Why do administrators only last 6 months? I think I answered that on here. It's just an average. I have seen administrators walk down in 1 week, 1 day, 1 month, and I've seen administrators work 1 year, 2 years, 3 years. So it's just an average that my teacher taught us is 6 months. So, just by me doing interim work, I'm there anywhere from 1 week to 6 weeks. So that goes in average because last facility I worked in, they said, this is the fourth administrator been in this building. I said, well, you really shouldn't count me because I'm an interim. And then when you get a new administrator, but that's the average because interim administrators, um, let's say you get somebody work at a job for a year and then an interim come in and then he found somebody. I mean, that's basically three administrators in 1 year. So when you average that out, that's why you get your six month average. Let's see. I really appreciate all your answers. It was really helpful. Well, thank you, Patricia Cooper. Let's see. Hmm. See, Michael, hey, I graduated in May with my BHA. I am looking at getting my NHA license in June. Is it difficult to find a job once you get your NHA license if you do not have any experience? And I kind of answered that, I believe, when Patricia asked that question. Basically, you just got to be willing to move. If you're waiting for a job to come to you in your home, in your area, it's going to be very hard. If you're willing to move around, it's kind of difficult for me because I'm a homeowner. But if you're in an apartment, most of the time, when at my first job, they gave me $2,500 for moving fees. So, so if you're in that type of position where you can move around, it's not really that hard. It's more now easier as a new administrator because a lot of the older administrators, that's why I'm doing a lot of interim work because a lot of the older administrators are getting out of the industry. They are scared to death of the COVID, and some of them just like, I don't want to work in a nursing home right now. So it shouldn't be that hard right now. Even when I told one of the RDOs, I'm taking off, and my plan was to take off in November and December, but I worked 3 weeks in November, and then they actually had a place for me to go right after that. I said, no, remember I told you I'm going to go ahead and take off December. So definitely it's more than enough work out there, beating them off with a stick. So definitely should be able to find something, but you just got to be open for relocation. Uh, there's a lot of headhunters. Spencer Coon. If you look at Spencer Coon, he's a headhunter. I don't know if he's just for Texas or all over, but he is. I remember I met him because he just called me at a facility where I was an administrator and asked me. They do that a lot. A lot of the headhunters, when you are administrator, they'll call facilities and say, "Yeah, do you know any administrators looking for a job?" And then you be like, "No, I don't know anybody." Well, what about you? Are you looking to make a move? I don't know if I'm telling any secrets of the industry on that one, but a lot of headhunters do just call facilities looking for administrators. A lot of companies, even when I've been on assignments at different nursing homes, I get called from headhunters and looking for more interim work than anything, but they're looking for permanent placements also. Uh, let's see, can you tell me about the NHA national tests and costs? Oh, no. Well, that was back 11 months ago. Definitely, like I said, 2004 is when I took my test. I don't know, it probably changed over the years. I can't remember costs. It's right, 200, 250, 275, one of those. Uh, Definitely cannot remember about the cost of those. Let's see. There was one that had like 4 questions on it. Let's see. The person doing the LT provides uncertain as I. Okay, I think that's a personal question. Let's see. Okay, I think I am not savvy on any of this technology. Let's see. Because once I answer something on Google, it looks like it just it takes away the accurate, please. Let's see. Okay, because I'm clicking on one now. Information on your channel, get messages. All right. See. I want to really answer her questions too. She has some very good questions. Maybe I will find it for next time. I told her I would do a video on it. It was like 4 or 5 questions that this person asked me, and I cannot find it now. I know one was census data, which a lot of census data. You know how you use that information. Census cure all wounds. So if you have low census, you're going to get a lot of slack on everything else. CNAs with overtime or too much time, which you can and can't order. Because, like I said, on the spin down, if you're supposed to have 80 residents, you got 60, but you're still trying to run everything as 80 residents, you're going to get chewed out. You know, that means where you might have $4,000, it went down to $3,000 for supplies or nursing supplies or things for the nursing home. So your census data, the data that you know, and it helps when, let's say you might supposed to have 80 residents and then went to 60 residents, but if there are high acute residents, that kind of almost pays for not the 20 missing residents. So census is very important. It's going to make you or break you. You can make a lot of mistakes, but your census is good, and they may not make. They'll double think making a move because, especially if you got them out of a rut where your census, you went to a low census building, and then you build up the census. You're going to be able to make a lot of more mistakes. Where if your census is low and you do one thing wrong, they're going to be like, "Oh, let's get the person out. He's not doing too good of a job anyway." So. I know census has been very hard during the COVID-19, so you have to definitely use all time. You might have to go for behavior. You might have to, a lot of the hospitals you can't visit right now. You have to go only to see the residents that they might have to send out. Make sure you're using your here we have. What's that system called? Well, we get referrals on the fax machine or through your computer. So there are services and ask your local hospital, because not everybody uses the same one. But call your local hospitals in the area. Make sure that you're using the software to get referrals. It just slipped my mind. I mean, I am so sorry, but ours. Let's see, I cannot remember, but make sure that if you do use the systems, that your information is up to date on what type of residents that you can accept. A couple facilities I went in and looked up their status with the system. They didn't have anything filled in, so they basically just saying that they couldn't take any kind of residents or didn't have any kind of specialty. If your nurses are certified to take trades, and you have trade training, you want to make sure that all the hospitals know that you can take old trachs. And when I consider old trachs, anything after 30 days, I wouldn't not take a new trach, someone that just had a trach put in 1 week and then they want to send them out the next week because there's so many complications that might be able to happen. But I don't have a problem taking an old trach, especially we have all the supplies and ways to make sure that we have to have a respiratory therapist come in, and you just have to have it set up. But when you look at your money rate on trachs, when there's certain things that you can look at that you're going to get a higher dollar amount, and that's going to make you shine because it makes the nurses should feel good that they can take care of it. Because when you can take care of a high acuity, that means you can give them raises. A lot of facilities are on stop on raises right now because there's not money going in. There's a lot of money, more money going out. So if you can make your building profitable, especially during this quarantine season and era, then you'll be a rock and roll star. And that's one way that you definitely can get your path to being a RDO faster, is making sure that your building is in top-notch shape. You don't have staffing issues. Your staff likes you, and not because you're a funny guy, because they respect you and you respect them. I done had CNAs many a time saying, I don't like working for you, but if I ever have my mom in a nursing home, I want you to definitely them to come to your nursing home because you don't play any games. And I'm like, well, thank you. But yeah, so you have to have respect of your staff. You got to make sure that definitely that your building's in top-notch shape, that your financials are looking good, and your census is always going upward and are stable. And the less they hear from you, the better it is. You got people. Every facility now has a corporate 800 number, and that can make or break you. Where they're calling in on you basically, or your DON, or so forth, because it's for staff. So and I can take that because if I'm going to tell you to do something or ask you to do something, it's going to be the correct way, and only if my approach. But I used to tell one lady all the time. I said, you're always right, but it's your approach. She came out really rough, and when she was talking to staff, so I used to, and with her staff, I like, yeah, what you told them was right, but can you work on the way that you present what you want to say? So, like I said, you got to have your staff respect you in that way, where if you do get on them, they're not taking it personally. Just let them know this is an opportunity to do something better, and we all make mistakes. So, just knowing different types of administrators, different styles. Just thought that was important to say. When you become an administrator, whoever you are, it's just gonna amplify who you are. So, if you're a narcissist, you're just gonna be more of a narcissist. If you calm, cool, and collect, you're gonna still be calm, cool, and collect. So becoming an administrator is not going to change your personality. And just like I say, there's not bad police. The police force isn't bad. It's just people in the police force that are bad. It's administrators. Administrators can be good or bad, and just who you choose to be and what type of management style and leadership style that you're going to put forth. I'm really a friendly guy, but at work, I'm more structured. So, because I know it calls for structure in a nursing home. But it's sometimes that you can let down your hair. If I'm not a woman, but you let down your hair, and you want the staff to know that we are a team. That's where you have a lot of team building. Where you go around with $20. Just take $20 and get $1 lottery tickets, and just go walk around. I seen you rolling Miss Smith around to her room, and she's usually there until another hour, waiting on somebody to move her. You did it without anybody asking you to do it. Here's $1 lottery ticket. Staff eats that stuff up. It's not the amount. Sometimes it's just for them to hear that they're doing a good job. Oh, I should have brought some water. My voice is great. Go out, and I've been on here an hour and 24 minutes. Any other questions? Going to wrap it up. Let's keep it around an hour and a half. Any additional questions? Did you like this? Maybe we can do it another Sunday, and with additional questions and answers. Give y'all a chance. Y'all probably didn't think I was coming on. Like I said, definitely just got new internet service and forgot to connect my laptop up to my new internet service, and then I did have a friend over. He couldn't find the game, and I kind of went all haywire at the last moment. Teresa K says yes. Okay, so you did find it very helpful. Come on, give me another question. We got another 5 minutes, and then we will end it. So the room is open. Still got my sanitizer right here. Put some in. How COVID has changed being a new administrator. Being a new administrator? I don't know how it changed being a new administrator. I guess being an administrator, there's a lot of changes. And you can probably find out on my last video I did about COVID. You got to make sure that you're doing everything by the guidelines and keep you a COVID Bible, which is all the regulations that your state has put out for nursing homes. You got to have that. So, because some staff will come and ask you, and then some staff is going to do what they want to do, and then you got to be able to tell them why they can't do it like that anymore. So, things we need to know, Texas. Okay, so let me reread it. How COVID has changed being a new administrator. Things we need to know, Texas. Keep your Bible. Like I said, there's so many new rules and regulations, and they're coming out. Some at the beginning they were coming out daily. We would print out something, start following it, and then 2 or 3 days later, we get word that, oh yeah, they already changed that. So I don't know if you've been a new administrator. I don't know if you're in the building, but I'm sure you felt those changes being made pretty much daily. They went from 14 days to 10 days for our staff, and then they then said staff members with COVID could work with COVID residents. And I told someone that, they said no. Now I had to bring it up and show it to them. So you said in Texas, so I might be able to show you the COVID. What it is the policy and procedures for COVID in nursing homes. I call it the COVID Bible. Nursing home. So what you get is the CDC, but you want the one from the state. HHSC. Because like I said in another video once, okay, so if you look it up under texas.gov, HHS, I will print that whole thing out and learn it, because they update it, and they send out updates. So it goes through, let's see if I can blow this up. It covers visitors, it covers residents, it covers hot zones, it covers staff. So if you just go by that, see, one of the first things, I don't know if you can see that. Let me see. But it says, it goes, can newly admitted residents who are asymptomatic be tested for COVID-19 instead of to be in quarantine for 14 days? And the answer is no. So if you have this and you already have it printed out, and that's how I was doing it. They asked a question about visitors. It says right here, visitors about this and this and this about visitors. So try to print out, and like I told you where to find it. This one is 23 pages. And as you see, they already made changes because they read, I don't know if you can see this. See how they read that out? So some of these things has already been changed and they took out, and that's daily. But like I said, you being a new administrator, definitely use your nursing home liaisons. That's somebody who worked for the state but they're not there to get you in trouble. They're there to be a liaison between the facility or the administrator and the state. So, and you can trust them. You can talk to them. You can tell them problems you have. They won't go back and report you. They don't supposed to. So, and if it's something major, they might, but they always told us that they're there for you, so you don't get deficiencies. So the last place I went to, they didn't even think about the liaisons. I like, yeah, use your liaisons because they're gonna know the new rules and up to date everything because that's their job. And my liaisons right now, they still sending me information through email because when they get it, it goes to liaisons, but sometimes they don't get to the companies or to the administrator. So I definitely, when my liaisons get new information, they get sent out a email blast, and I take that new information, compare it with the old information, and take out what if I need to, or or change as we need to. Do you offer mentorships? I am in Texas. Yeah, I don't know if I mentioned this before about the mentorships, but your preceptor should be your mentor. I'm I'm not a preceptor anymore, but when you get your preceptor, that's somebody that's going to actually walk you through the process of being an administrator for 6 months, which is 1,000-hour internship. I don't know if it changed to 1,500 yet, but when I did the internship, it was 1,000 hours. So you basically are going to be with an administrator for 6 months. The way that I did my internship, yeah, you're not going to see me 8 hours a day for 6 months, but let's say the next 2 weeks you're working in the kitchen. Now, my free time is usually around 4 or 5 when things are winding down for the day, if all possible. If not, I just told them we'll talk the next day. But every hour, the last hour of what you already did, they need to call you in the office and ask you what you learned today. I usually ask my AIT, if I had them doing, let's say in the kitchen, dietary aid. I'm like, well, why is that important? What did you learn from being a dietary aid? Because my job is to make sure you know what to look for. Since you actually worked as a dietary aid, since you actually worked as a cook, since you can't work as a CNA, but you can follow CNAs around and be an NA where you can pass out water, ice, make beds. So when you're doing your internship under me, it's almost like Mr. Miyagi, wash on, wash off. You don't know, you might not understand why you have to do that. Cause I had some people, they thought they were just too high class to go in there and be a maintenance man. But and I don't think their career went far in life. But yeah, you got to be acceptable to go into each department, learn everything, because that gives you the questions to answer. Why you haven't did these things? They haven't unclogged the toilet. Well, he's like, no, I remember when you did it, or a light bulb, or when your maintenance man say, yeah, that needs a valance. I had to change valances. First time ever. Maintenance man said, if you touch the 2 wires, you're going to shoot across the room. So I kind of know the dangers of being having a valance out, or when you're replacing it. I understand when both lights go out, it must be the valance. So you need to gain knowledge not only from your preceptor, which is your mentor, but also from each department head that you work with. Food service director should be telling you everything about food service, what to look for. How do you know when it's food coming out late, or or you don't have enough supplies, or you should be in every department for a certain amount of time, and it's not like across the book 2 weeks. Whatever you feel weakest at, that's where I would say you should spend the majority of your time. I didn't have to spend a lot of time in food service because my background as a food service manager. I'm pretty keen to it. So I spent more time in nursing, maintenance, things that I wasn't really comfortable with. You got to get out your comfortable zone. Business office manager, spend a lot of time with them, ask them questions. You should be able to, read what read the reports that they get from corporate, understand those reports. Why am I signing this? You got to sign your 3618s and 19s. 3618s is when is Medicaid, 3619s are Medicare. Brief way to remember that the higher number is Medicare, you make more money off Medicare. So that might be a test question. Which one's 3618? Which one's 3619? 19's higher, Medicare. So you can remember it like that. So, but you're going to be signing a lot of things from the business office manager, and you need to know, why you sign it. Then, right before they already end their internship, I let them shadow me, and then for 1 week, and then I literally let them be the administrator for the last week. I'm still there. They can't make any major decisions, but I want them to sit behind the desk, and if somebody come in the office with an issue, I'm usually sitting on the opposite side of the desk and let them sit in the desk. And then let's say nurses has the DON has an issue. I let them sit down. I'm listening at the same time, and I say, well, how would you handle that situation? So most of the time, by that time, they already know, because they already been through nursing, what they need to do. And then they definitely learned so much during the program because they was acceptable to learning all the departments, and they kind of know what to do. And that helped them when they go off into their own facility. See, I don't even know how a lot of preceptors do that, but that's how I do it, because I want to make sure you're the best representation of me, because me being your preceptor, I take that personally, and I don't want to see you fail. And but you get a lot of preceptors that just when I went to also become a preceptor, one of the many times I've been a preceptor, the license is good for 2 years, and you have to go and get it renewed every couple of years, I believe, and which I didn't do this time. So, but there's a lot of people down there, because you get free 20 hours of CEU classes, and if you take on a AIT, and you get 6 hours of CEU going to the class. So if you're an administrator, you got to get 40 hours of CEUs every 2 years. So you basically already racked up 26 out of the 40 hours, and then you just do a couple or 3 or 4 classes you pay for, free CEU classes, compared to having to do 26 other hours and paying for them. So a lot of them just do it just to do it. And I had a lot of people, even when I was a preceptor, I can only have one at a time. So definitely try to find someone to be a preceptor that wants to teach you. I took over a lot of people who had preceptors, and they wanted new ones, and they came to me because they were like they wasn't learning anything from their preceptor. They basically just sent them on their way to do whatever, because all you need is them to, and then you get some AITs like that. They don't want to really learn nothing. They just want you to sign off on at the end of the 6 months that they did their 1,000 hours, and la-di-da, la-di-day, and gone on their way. So you have to be this something. If you want to be a administrator, you have to first, when I interview for AITs, I ask them, why do you want to be an administrator? And if they give me that, I want to do good, I want to make changes, I'm like, come on, give me the real reason. I don't want to hear the same old answer. So I would definitely ask you, why do you want to be an administrator? If you say, I want to make changes, well, how are you going to make changes when corporate tells you what to do? You're not freestyling in a building and get as many as everything you want. You still got to run a budget. So I don't want to hear it just because I want to help others. That's such a cop-out answer. I want to hear, your passion. I want to hear, why you love what I do, because I take it personally, and I don't take everybody. When I was a preceptor, there are certain people I just wouldn't do, because I just know they wasn't in it for the right reason. People hear that this industry makes a lot of money. And, you definitely can be 6 figures easy in 3 to 5 years. So a lot of people hear that and, I'm going to be an administrator, but they don't have it in their heart. I used to, even when I was little, we used to go in nursing homes as a church, and my mom and dad, we used to go sing in nursing homes all the time. I have a real love for geriatric residents and people in general. Even right now, while I'm taking my little mini vacation, I'm working with SOS. If you're in the DFW area, definitely try to get with SOS. It's supplying our seniors. And even just like last week, we went and took blankets, socks, and cards to people in the community at an apartment, senior livings, of 55 and older. They can't get out right now because of COVID. So if you're not like that and have that mindset anyway, I wouldn't take you on as a AIT, because I just don't want you in it for the money. Because if you're in it for the money, you'd be the first one to leave, because you're like, yeah, I'm making good money, but this is just too much. Are you willing to be woken up or sleep light overnight every day and the rest of your life? Because you don't know when your facility is going to call. When you want to go out and party on Saturday night, you got to have in your mind that, something could happen in your facility. So it's more of you getting good money, but it's a lifestyle change. A lot of people don't stay in the industry for long. I have trained people that are no longer in the industry because they just couldn't. They work 5 or 6 years and they're like, this is like. When they used to walk in my office, I said, or when they're in my AIT, I always used to say this, and this is probably going to be the name. The book is So You Want to Be a Nursing Home Administrator. So even when they're doing the AIT and they around there sweating and humping, I like, so you want to be a nursing home administrator? You want to be a nursing home administrator? So I keep asking them that during their AIT, just so this is how it's going to be. Even when you're on vacation, you can, if you have your building, something go wrong, you could be on a cruise. I know an administrator, he was actually on a cruise and got an IJ when he was on a cruise, enjoying his vacation. So it's a lifestyle change. So if you're not ready for that, then you might not want to be a nursing home administrator. So Teresa, are you ready to be a nursing home administrator? Are you still on? Hope I didn't scare you away. All right. Any other additional questions? And I hope I did answer your question. If I didn't, then please email me at license to care for you. Let's see, to care for you. So the 2 and the 4 is actual numbers. Sorry if y'all hear that background noise, some cars outside revving the engine. You ready? Okay. I should have did this in the back of my house instead of the front of my house. Let me see. All right. So license to care for, and then just you, not the you, but just you. So license, the number 2, care, then the number 4, and then just a you at gmail.com. So you definitely can always hit me up there. Like I said, I got free time a little bit now. So yeah, make sure there's something that's in your heart and not just the money. Yeah, you can make a lot of money. One of the job markets people really don't focus on, just by being on YouTube, I see a lot of people with a lot of different roles where they get, I only got about 330 subscribers, and I've seen people start off this year and got over 3,000 or 4,000, usually a sports or talking about sports. So it's not a job a lot of people know. And you said put it in the comments. All right, let's see. All right. Get that. So it's not a job that's known. A lot of people just don't grow up and say, yeah, I want to be a nursing home administrator. It's kind of a job or a career that people kind of find along their way, either be in the industry. Like I got my opportunity. I was a food service director at a assisted living, and my executive director, she was an administrator. And how can you get familiar with all the federal regulations? Well, the federal regulations, the NAB is, I don't know what state you're in, but print off your policy, your rules and regulations for what books would you recommend. Well, your federal regulation, well, your state regulations are going to be something you can download. I don't know if you started class yet, but Arizona, have you started class? Because in our class, we all had to have our rules and regulations for nursing homes. Like 19.701, administrator is as always over their facility in 24 hours, 7 days a week. I think that was 19.701. But yeah, you can point 701. I usually just put that in and put in DADS, and it pops up to rules of nursing home. So if you want to, I don't know if Arizona should have that once you put in a code for a nurse. I always remember 19701. It might not be that anymore because everything changed. But when I put in 19701 DADS, which is Department of Disability and Aging and Disability, it just goes to 19.1 basic in scope. A lot of it has been crossed out, but I will get started. You said federal regulations. We learned that in class, so not yet. I'm still trying to figure out how to even start. Okay, yeah. Once you find your class, your federal regulations, there is a NHA book. I think it's called NHA, NFA, where you learn all the life safety regulations, which are more national. So see, the way of deficiency work is. The federal regulations are a little bit looser than the state regulations. So, they might federal might say you just got to have a sink and a toilet in every bathroom. So, okay, that's the only regulations they're going to have. Make sure you have a sink but state regulation might be, now you got to have a bar 36 inches off the ground for a resident to get up and down on. So, federal regulations are loose, and then state regulations are more hit harder or more, difficult. So if you know your state regulations, you basically like I said, the book for national, I think it's National Fire and Safety. Like I said, I haven't took this test since 2004. Networking Organization for Administrators. Trying to start that now. There's like I said, if you are an administrator, there's ways that you network just naturally. You're going to have your hospice companies coming by. We're having a happy hour at so-and-so place, 6:00. Here's a flyer. When you get there, you're not going to be the only administrator that was invited. You're going to be be able to network with administrators there, get their number. If they work for a different company, get their ask them about their company, because you might want to make a move one day. It's just natural ways that we network, especially here in Dallas. CEU class. If you go, the state was giving free CEU class in Arlington before COVID-19. When you go there, you're not going to be the only administrator. You're going to be sitting there with surveyors. You're going to be sitting there with other administrators. So the TACA conference that we have once a year, but since COVID, it's I believe it's online now. When you go to these conferences, make sure you meet people. You inquire and learn as much as you can while you're there, because you're in CEU classes. You're doing tours of different vendors, but make sure you do your walk around and talk with different people, not only from your current area, because when you do state events, they're going to be coming from everywhere in the state, so you can bounce out questions with current administrators, get their phone numbers, build up your own network. On my phone, I got several administrators right now that if I got questions, let's come in the building and they don't know how to do something, and I do. They can give me a call. Especially my AITs. They call me out a lot when they first got going, and I make calls too. Like I said, I talk with my not only the nursing home liaisons, but I might run something off another administrator, or when I work like I'm doing interim work now, since I've been at several facilities. The previous place I might went to, I might call administrator, hey, they not doing like that where I was at, or do you know what the guidelines for the corporate is when you do this? So you'll get a lot of numbers, especially not only administrators. I would tell you to every DON you come across, if you feel that they have an ounce of good to teach you, definitely write their numbers down too. When I'm in a nursing home and I got a couple of DONs that I respect really well. And if it's something that I'm not sure about and the DON doing it, I call a DON that I do know and trust and say, okay, our DON is doing this. Would you do that? Bounce off ideas. Let's see, are there any AIT programs online? No, AIT has to be done. And I'm sure it's like that. I think you said you was in Texas. Yeah. AIT programs have to be in the nursing home. And I don't know since COVID-19 how they have changed. If you are in Texas, you definitely can call nursing home administrator board with the state, and there's somebody you can talk to. This year, I just got my license renewed, and I didn't get a license. So there's so many changes since the COVID-19 hit that I can't answer all questions, but you definitely can reach out to them. Either through phone call. When I called about my license, I think I had to leave a message because a lot of them are working from home. And I think they hit me back on the phone or emailed me one, said, yeah, we're not giving out license. You have to go through the TULIP program, which is now how you put in all your CEUs. So being an administrator, things change just like that. So they're not giving out licenses. I don't know, after you get your first one, you'll get your first one, but on your renewal, you just go out there and you either print out, because when a surveyor come in now, they have your license number. They can look up the same information. It's not like 3 or 4 years ago when they come in, they go and look on the wall at your license and get your number. And, once your number, they can go look up everything that you've been through now. So they have streamlined being a nursing home administrator. Let's see. I am preparing to take exams, requirements done. All right, great. Keep us and use this right now as networking. Everybody on here definitely try to reach out to each other and be someone where somebody can lean on you or you can lean on them. Are there any AIT programs online? I think I answered that. I'm not sure. I know it traditionally can't be done because, like I said, you're supposed to spend time, and they were really stringent. When we go and learn how to be a preceptor, they tell you things that they found, things that they ain't gonna put up with. And one of them, it was actually a AIT actually working as an administrator in the building that they found out about. They were just going to work there. So the corporate actually put an AIT in a building by themselves. And when 6 months, they were going to sign off on their paperwork. So state found out about that. So definitely you have to go through every department. And you can't get put in 1 month that you did all 1,000 hours, because you can't do more than 40 hours a week under the AIT internship program. So I remember that number. Because I'm like, well, maybe I work 50 hours this week. And they're like, no, you can't do any more than 40 hours. So I would say no, but since COVID-19, I would definitely call your what we consider disability and aging and disability, a Department of Aging and Disability, what it's called in your state. Because I did find out just by trying to get my license in different states so I could travel more when I was doing that. I know every state doesn't call it the same. and ours changed now to Health and Human Services. Uh, so whatever your state name is, definitely give them a call. Ask them for the nursing home administrator department, and there should be people there that can answer that question for you. So basically, you work in a nursing home under a pre. Yeah. Well, it's basically you're not working unless you're getting paid. Uh, Most AIT programs are not paid unless you find a corporation. If you go on Indeed and put in AIT, sometimes you might get a paid AIT depending on the company, but there are far and in between. I literally, to be an administrator, had to work at an autistic treatment center where I went in on Friday at 3 o'clock and did not get finished and lived there till Sunday at 6 o'clock. So I got paid literally for like a little bit over 48 hours or so. But that's how I made it because I was in a non-paid internship and I wanted to be an administrator. So, but Monday through Friday, I was doing intern work as a job where you wasn't getting paid for. But I did go when I did my internship with another company. I did get paid as a food service director because they needed one on record, and I got paid like that. So, sorry, I'm trying to understand the AIT program. Well, I'm hoping I'm giving you the right answers. And I definitely went over the AIT program at the beginning. I know you probably came in a little bit later. So if you rewatch, we did talk about the AIT program. What in particular you want to know? Any other questions about the? I hope I'm answering your questions on the AIT program. Let's see. I currently do work in a nursing home in the director of social services. Oh, okay. Are you a social worker? A lot of social workers that do become administrators, they're really good. I always try to look at the background. Okay, if you're a social worker, they really make great administrators for some reason because they understand the social aspect. I always thought I was on cloud nine because I'm like, well, because my degree's in hotel restaurant management, and I treat a nursing home like a hotel, which a lot of people can't do since they never had that type of training, but it's the same aspect. You're taking care of somebody's paying for a service. You want to make sure that, they're taken care of and they got everything they need. So in a hotel, I would do the same thing. And I do that at my, if things are broken as a general manager of a hotel, I'm going to make sure it get fixed. So my background in hotel actually shined in the nursing home because my customer service is great when it comes to residents, family members. And even where I have bad nursing staff that I don't care what. I said, well, we need to call this family back. They call with a issue and we need to try to fix it. They always complain. I'm not calling them back. I call and make sure, and all the families thank me. So there's certain careers that when you come into nursing home that I see a lot better success. So okay. Yeah. So, oh yeah, you will make a very good administrator because you're going to understand residents and family members where, you get a lot of people, with any 4-year degree, you can go and become part of the administrator program. So, you get a kinesiology major, they're not going to know anything about, with my hotel restaurant, you learn about management, people, customer service, tax to use different tactical situations used for finance, how to boost up your finance, especially in restaurants. But I just took all that and just brought it with me to being a nursing home administrator. But a lot of social workers that want to be administrators, they are really good at being administrators because they already understand. And if you're not an administrator, a nursing home, then I would definitely, if you're not, have never been in the field and you want to be an administrator, I would, before COVID-19, definitely tell you just go do a tour or do some volunteer work and see if that's something and watch the administrator and see how they act. See how nursing, when you are a family member, nurses talk to you completely different than when you are a staff member sometimes. So, you'll see all that just by volunteering. See how the activity director interacts with the residents, and that kind of give you a foothold on if that's something, that you can handle, and the stress level. And a lot of nursing facilities are higher than others, just by doing intern work. I've been in buildings where I was just basically babysitting the facility because everything run perfectly. And some facility you got to jump in there and hit the ground running and keep it afloat. So, like I said, no nursing homes that run the same. For brand new administrators, getting first building for clinicians who become administrators in the Outlook better, easier to get first building. Outlook for brand new administrators getting the first building. The Outlook, I think, I don't know if this is like when I was telling her that being a social worker, she would have more of a grasp of being a nursing home administrator, especially she says she works in a nursing home. But let's see, clinicians who become administrators. Let's see. Okay, you're a nurse. Well, I mean, if you actually are working at a nursing home, you would be pretty good also, but you don't know what administrator. I don't know if you're an LVN or RN or DON, but I know a lot of DONs that went and get their administrator's license, and they don't use it after they've been an administrator. Go back to being a DON. They don't want to be in these shoes. The buck stops here. Let's see. Let's see. I am a nurse. So, are you an LVN or RN with a 4-year degree, and that's why you're trying to be an administrator? I always say I want to go back and be a nurse so I can get on that side. Charge nurse with masters in HH law. Okay, well, HH law. I think that's. I don't know what HH law is. Actually, I'm at the same time thinking about going back to law school myself. So, masters in HH law. Okay, so you as a charge nurse, yeah, you definitely know what goes on in a nursing home. It depends, and I don't know what type of charge nurse you personally do. Health and hospital law. Okay, masters in. Okay, so and you may not even have to do the full 1,000-hour internship. Definitely, if a lot of people with masters, they will lower it by 300 or 500 hours, which might definitely give the nursing home administrator or department at HHSC a call, and they will tell you if they would give you any leeway off your internship. Charge nurse, and okay, let's see, skilled rehab and cardiac. Okay, great. So you are skilled rehab and cardiac. Okay, is that a nursing home setting or a LTAC, or what type of facility are you currently in? Okay, because they got rehab centers. So I'm not sure if you are in a nursing home already, or LTAC or rehab center that specialize in cardiac and rehab for heart attacks. Let's see, there are, yeah, specialties. Okay, okay. So yeah, are you in a LTAC? Those are the specialties. Okay, okay. So it's part SNF and part LTAC. Or okay, LTAC with a sniff at the bottom, because I've been in hospitals that actually had a skilled nursing. Okay, yeah, you should do well. I mean, right now you have an administrator there with you. I don't know how observant you are, or try to see what they're doing on a daily basis, but you kind of know what they deal with. I'm sure your administrator right now come to you and ask questions on residents. They might have got a call from Mrs. Jones, and they said they don't feel their mom is not getting medicine or something. The administrator may send the DON to you, or they may come at you on their own just to get them information so they can go back. But yeah, I had staff members say, "You don't do anything all day." I'm like, okay, come sit behind this desk for a day. So, but they're not very observant. Now, if you're observant and you're like, yeah, that administrator, I notice he does this, and like I said, there's good administrators and bad administrators. Uh, I have been in like where I was at for 8 years. You get CNAs who work at multiple facilities. Maybe do ours full time, somewhere else part time, or us part time and they're full time. And they like, you're not like the other administrators. You actually talk to us. You actually walk around. So uh, just what we've been talking about in the last couple hours, I would definitely what I said I would do on a daily basis. Is Texas among the best for? No, we're like last or next to last in reimbursements in nursing home care. And you can look that up on Google. It's a bad statistic about Texas. Like, I'm only here to promote the good side of being a nursing home administrator, but there is a lot of bad. And just because, I plan on being in the industry at least another couple of years or two or three. Don't want to get to the bad, but yeah, Texas is basically for reimbursements. We're second to last or last. You can go to other states. The administrator makes more money. The CNAs make more money. Just staff in general make more money because they get more money in through their state. Texas is really bad on reimbursements. So no, we're not among the best. And even our care, we looked that up about 2 or 3 months ago and it says that Texas is pretty close to the last place in care also. So there's a lot of bad administrators, and that's one of the reasons I wanted to make this platform. Because if you don't know, you don't know. But there's been a lot of bad administrators coming through, and a lot of bad administrators I meet, and it's not because they wanted to be bad; they just never was taught correctly. And I like, who did you do your AIT through? And like I say, I definitely try to everybody that I put forth and be an administrator, make sure that they are prepared and ready. Or I will definitely cancel the AIT program. If I could tell that you don't have it in you, I'm not going to sign off on your paperwork. And I'm going to tell you might need to go find another preceptor because this is not the career for you. Let's see. I'm in Atlanta. Okay, this is saying, how do you find it? I already discussed how to find that, Lynette Chin. Just go to your state nursing home administration program board and ask them for a list of preceptors in your state. Being in Georgia, I'm sure they have a lot of people because, like I said, for us to be preceptors, they give us 6-hour credit. And if we take on being a preceptor, we get 20 hours taken off of our renewal of 40 hours altogether. So a lot of people like doing that. But like I said earlier, there's certain preceptors that just there for the credit hours and don't want to teach. And that's why, like I said, I started this channel because I like to teach and talk to people about being a nursing home administrator. It's very exciting for me. Like I said, I probably had just as many good days as bad days, but one of my AITs that's now a nursing home administrator, I asked her to be on the program one day. I think she's pretty much done. She's a good administrator. She just get the bad end of the stick a lot of times. Like I said, you make it 6 years and you switch. It's not uncommon. I just hate to tell you that. There's a lot of stuff you have to put up with. You got to be mentally ready. Are you mentally ready to go through the bitching and moaning of corporate? Get this right, get this right. Then you get a lot of bitching and moaning about your staff. They bitching and moaning at you. I'm sorry, I'm using cuss words, but I'm putting it all out there for a little bit. I'm not going deep. Like I said, I'll probably write a book one day. But then your staff bitching and moaning. Then you get your family members that could be bitching, and you could do 100 things right. and corporate focus on one thing you did wrong. So you're like, it's almost like, what have you done for me lately? So you're always in that mode. And like I said, it's day and night, day and night. I've been in a lot of facilities that I fixed up. And, me and the DON went into one facility, and it was really a bad facility. And they was actually under where state came back in and found the same thing wrong. They were gonna get 2 fines for 750 each, all the way back to when they first walked in there. And we was there from 8 in the morning to 8 at night every night for weeks or months. And then once they came in and cleared us, we was expecting a phone call. Thank you from the corporate. Didn't even get one. So we saved them all that money. We know we was the only crew that could come in there and do it, but there was no gratitude. And then probably the next day, what are you going to do on? We haven't gotten our reports in, So you're being pulled from every direction, and you got to be mentally strong. You got to be physically strong. You have to, like I said, you got to be just ready for anything. You never know what you already missed until you get that email from corporate. Oh, well, this was due 2 or 3 days ago, and it might be a task that might take you 4 or 5 hours, and it might be on a Friday night. Like I said, I got to watch my game today. It was one time it was a report due on Monday morning, and they really didn't focus on it, or keep telling us, and I missed it. And my DON, she actually called me when I was out of town, and I was driving back this way. And she said, "Did you get that report in?" That I like, no. And I like, I just gonna get chewed out for it. But she's like, "You better get that report in because it's kind of important." And they already want to set examples in there. So I came back on a Sunday. It was a Super Bowl Sunday, and got my report done. I think I'm the only one that did the report through all the administrators, because they sent out a corporate email. We asked for this 2 or 3 weeks ago, and only a couple people did it. I was one of the people. So I didn't really get to shine because nobody even knew, other than the person that wanted the reports. But yeah, like I said, it's a lifestyle change. Are you a surveyor administrator like Dr. Jackson was? She was awesome. Yeah, she was awesome. You mean Princess Jackson? Oh yeah, she worked for the feds. No, I'm not a surveyor. She actually was a state, worked for at the federal building. And like with my video I did about her, because I always want her to be member. I even asked new administrators now who they went through, or not now, but administrators that I meet for the first time, who they went through. And it was like 90% Princess Jackson. Now, it's going down slowly. So I wanted her to always be her memory of her should never go away. She was a great teacher, and she taught me a lot, not only as an administrator, but an African American administrator. Some of the things that we have to go through. I remember she said, never get a nice car as an administrator, never have a better car as an administrator than your RDO. And that was so true, because even when I did get a Mercedes, a lot of people was like, you could tell the looks, and then you could see them digging into you a little bit deeper. So yeah, driving a junk car to work, just so many other reasons too, because my car been scratched up so many times because firing someone or terminating someone, or an employee get mad at you. Yeah, they'll scrape up your car. So you don't want to drive your best car. I am glad I did my courses through her before if you had the opportunity to go, she knew her stuff. And I just hope that y'all see me like that, as somebody you can go to. Actually, the classes she was giving in Fort Worth, it been a couple of times where they wanted a teacher. So I guess they got one. I wouldn't mind being a teacher about nursing home. And when I was, like I said, I've been in it 16 years now, but after 5 years, when I'm going through the first 5 years, I always wanted to model, and like, if she wanted to give it up, I wanted to be a teacher, but not so more now. I got so many things on my plate. but yeah, she's definitely worth the class. And like I got her for 2 years. I was in the last class that they did at University of Texas off of Harry Hines. So we were the last class. It was three of us, maybe four. It was I think it was two classes, but in my class it was three of us. But it was one student that was coming in that was finishing up. I think she didn't have to do what we was doing, and we were the last graduating class at the University of Texas Allied Health being an administrator, and it was a 2 year. I really think that the courses should be 2 years instead of 1 year. There was so much that we learned, and because we did literally a year and a half of classes and 6 months as an internship. So, but we did our intern. No, I guess 2 years of classes because we did our internship and went to classes at the same time. And I think that was, yeah, yeah, Tarrant County, yeah, Fort Worth, right? Yeah, I remember when she was out there. And then she after she was doing both at the time, and then she after the UTD, I mean not UTD, University of Texas, um, medical center, medical center. It was actually off of Red River or Red something crossing down there by Harry Hines area. And she, I mean, I still used to get to talk to her. She was my best mentor when I was administrator. And she actually helped me get a job. She actually talked me into not quitting the program. Like I said, I wouldn't even be here if it wasn't for Miss Jackson or Dr. Jackson. And she just taught me so much and just, kept me under her wing all the way. I remember that time we went to preceptor class and I forgot my money. And I left my wallet at home, and I only had, or I left my card at home, something where I only had an X amount of dollars in my pocket, and I couldn't get any more because I think I took my card out to make reservations, and I think I left my card, and that was the only card I had at the time. Now I got other means, I got other credit cards, but it was either I left my wallet or something. But I had money. So I remember I got to halfway there. I'm like, well, if I fill up my car, I could get all the way back home after I leave. But I only got like $5 to eat on or something. And, I had to go there that night. And I think I ate that night and I didn't have any money. And she gave me some money. And then when I got back, I tried to pay her back. She took me out to eat, gave me some extra money. So she was, I was always her little person that, she took under my wing and helped me out as much as possible. And she was very well liked and known by a lot of the owners because all of them went through her. She'd been doing it for like over 20 years or so. And she actually was doing where you go into facilities and do mock surveys. I remember she told us about the mock surveys. So I don't know if she did that at the end, but she was doing mock surveys. And then, cause you would never know she had money. And I'm like, why she got all these jobs? They were doing $20,000 of pop surveys. Oh, I'm like, good gracious. That's all right. Like they say, don't count somebody else's money. I was counting her money as an AIT when I was in her class. So I'm like, she ain't broke. So yeah, that's Miss Jackson. You would think she kind of remind me of the Yoda of the Star Wars industry. You would look at Yoda and say, okay, he carries a cane, walk with a limp. You think he can't fight, but then I don't know if you're a Star Wars fan, but then you see him in action, you like, oh, So she kind of lived like a life where she was not very well paid, or but she had some money. So I don't know. I know she wanted to get married at one time, and then she told us about being in the feds. Anytime she get a boyfriend, they have to do a background check on them, and so it kind of studied her social life. So only good memories of Miss Princess Jackson. All right, let's see. All right. Any other questions? We've been on here almost 2.5 hours. We went from an hour and a half to 2.5 hours really fast. Well, I guess we would do this again. And definitely, if you have any questions, I'll put up like I did last time when we will do it again. Um, Actually, it's 9:07 my time. And I'm hungry. I don't know about you, but I'm going to grab something to eat. So any additional questions? Let's see. Oh, hold on, Divine. Do you suggest transitional care centers for AIT? As far as I know, you only can do it in a nursing home. I think everything I read was nursing home. I don't think you can do your AIT at a transitional like LTAC. So yeah, so that's the problem. Okay. Teresa K. So you did it with Princess. Great, great. So you should be administrator by now. She passed away in 2018. And I think June 2018. Was that you get started or was you finishing? Have you finished have you started your AIT program? I can't remember. Because you should be administrator, I think, because right now it's a year program. I graduated the law program. Okay, let's see, the law program or the AIT program. You did that with Princess though, right? The AIT program. So you get a move on, get that done. Like I said, once you become an administrator, you're in another fraternity of people that think like you. Like when I do go in a new home, I don't want them to talk about the previous administrator. If they talk about them, they'll definitely talk about you when it's your time. So I stop them right there. I don't want to hear anything how this old administrator was. Like I said, there's so many things you just got to learn, and you won't get a grasp of what I'm saying or how it feels until you sitting in that chair. But yeah, your staff will try to test you. They'll try to find your weaknesses. Like your first day of being an administrator, they definitely going to ask you like questions, and you'd be like, okay, what have you been? It'll be questions where, okay, what have you been doing up until now? Type questions. They will definitely test you. So I was tested like my first 2 or 3 jobs. Now when I go in there, I say, yeah, I've been administrator for like 16 years. And you don't get a lot of tests, with years of experience, So, but they definitely would try to test you as a new administrator. And it's so funny because they just do it automatically. It's like they write a handbook, and you get different types of personalities in each. They're the same personalities, but just different department heads have the different one. Like you might have a fire starter, and all facilities usually only been in one building and I couldn't find a fire starter, but they get there because they always say the sky's falling no matter what's happening. So it'd be something, and it's always major problem no matter what. So they're fire starters, and oh, I understand. So sometimes it could be the MDS coordinator, it could be the business office manager. Sometimes it could be, there's a fire starter in every facility. You just got to find that fire starter. It's going to be somebody reserved and they have good potential, and you got to go and release it. You don't know who it is, but they're in your building. So there's all kind of personality traits that you will see in facilities. It's just by different department heads, and it's really fascinating that I mean, like I said, I could pick up different. I'm what's it say? I'm visually. I forgot what I've been tested where I'm visually perceptive of people, and I just notice. I'm like, you know what? Every facility I go to, there's this type of person, but it's always by different department heads. So definitely, I know one of the questions somebody asked was, what is his job of the business office manager? Just off note, I mean, you want to know anything about a nursing home, just ask the business office manager. Definitely, they are the ears of the facility. They hopefully they're somebody you can trust as an administrator. I know a lot of corporates, that's their inside person. So you ever want to know how information is getting back to corporate, it's more than likely either the DON or the business office manager or MDS coordinator. Those are people that talk to corporate because of their corporate duties daily, and they get a lot of information. I completed my courses in December 2017. Just completed the graduate law program. Okay. Oh, she was in graduate law program. I didn't know that. But yeah. So you need to do if you need to do your AIT, I would definitely say get that done. If you've done your AIT, definitely try to take the test. And I don't even know how they give the test nowadays. Now because I don't know if they still have the Sylvan Learning Centers open back up or not, but definitely try to take your state first, your NAB second, and financial third. I mean, I really don't know what's on the financial since we just had state and NAB to become an administrator. So one of my AITs, she was actually my marketer. She's the one who told me now it was 3, and she's about to take her test in January. So you know what she's been doing to study is cue cards, you know, older tests that she could find. You know, you just gotta make sure that you just keep studying and get everything. I know when I got my results back through mail that I passed, it was like, man, it was like a lot of hard work, a lot of uh, where you have to give up a lot, you know, so you're sacrificing a lot. Like I said, I was literally working on weekends just to pay for my apartment, eating ramen noodles. It was, you know, I didn't have the luxury of, getting, making a lot of money, but it was well worth it. Would I do it again? Yeah, I definitely would if I can go back in time and do it again. I wouldn't do it again now, but if I had to do it all over again, I would because I gained so much experience and knowledge, and not just by being an administrator, but now that my parents are older, I know how a nursing home is supposed to be, and I know the right questions to ask. When my dad did rehab earlier this year, they looked at me as an administrator because I was answering questions that family members wouldn't even know the answer I asked, and looking in areas where when they said it was my dad, and I found out it was nursing, and I'm like, if they're giving him his medications, why did I find this pill in his bed? They must not be watching him take it and swallow it like state regulations. So kind of, and then you can definitely help out other loved ones that's putting people in a nursing home. Go to their care plans with them. A lot of people, a lot of family members don't even, if you have family members that have someone in a nursing home, you can definitely go as an administrator and go into care plans and help them understand the terminologies, what they're saying, and then bring up other alternatives if they don't like that. Well, I know you can do this. Can you do that? And they, oh yeah, we could. So, because or they're like, oh, you have to pay for this. Oh no, that's you're supposed to get that from my mother or father. So yeah, you'll just get more knowledge being a nurse home administrator. Before I went to graduate school. Okay. So right now, yeah, you definitely need to do the AIT program. So if you can't find it, hit me back. But we need to get you in an AIT program immediately. All right, I got 5 viewers. Usually I am watching these live streams like for sports, and they have hundreds of viewers. So I got 5. So next time, let's shoot for 10. Maybe more people will come on next time. Again, I'm sorry, I'm just got on a t-shirt. The Colts played today. We did win. Yay. But we beat Houston. So I'm originally from Indiana. So I still keep up with the Colts. So if there is no other questions, I got less than 1 minute for it to be 2 hours and 30 minutes. And that sounds like a good cutoff time for me. So hit me up. I did put my email on there. Like, subscribe. I got 5 likes. So thank you. If you know anybody that want to be an administrator, definitely let them know about this YouTube channel. Oh, okay. So you just need a test. All right. Well, definitely. If you didn't learn anything from your administrator, thank you. I started classes in January. Okay. Thank you, Divine. Yeah. So I think everybody on here is at a different road. So Teresa, you already completed. You need a test. Divine, you started classes in January. So definitely build your own network. Keep up with each other. I'm going to try to find another avenue where we can always talk together. Also, while I do these YouTube videos and things where we can build up a network together. If you're not on LinkedIn, definitely get on LinkedIn. It'll start giving you suggestions for people in the healthcare industry. A lot of RDOs, a lot of owners, a lot of corporate HR people. But they're always looking. So definitely, if you say you're having a hard time finding jobs, definitely use everything. I usually use LinkedIn a lot. Then I kind of canceled my page because I was like too in deep with a lot of owners and regional people. And it was during the time before Trump about when we had it was a lot of things that I didn't like. Texas is a good old boy state. So that's another thing that we can't really talk about on here, but watch out for the book. So I kind of just took off my LinkedIn and just rejoined. There was a lot of racist things being said about, I'm like, wow, these are administrators and some are regional. So definitely got off of that. And I think I got it back. I really don't use LinkedIn anymore since I got so many contacts. So Divine, I hope you the best and your journey gets started. Well, let's see. You should be getting ready for your internship, which I don't even know how they're doing now. I guess you can be an essential worker at a facility as an AIT if they got you helping out, or put you on payroll, I guess. So, all right. If there isn't anything else, we're going to end the stream and look forward to our next meeting. Have some additional questions at that time, maybe on specific departments, maybe. But thank y'all for coming out. I know it's Sunday. Either you missed the football game or a home cooked Sunday meal. But go ahead and get it now. Like I said, I'm about to go grab something to eat. My voice is gone. Next time I would definitely bring some water. My voice is just gone. I didn't know I could talk for 2.5 hours. But y'all have a great day.